Yes, they're communicating that they cannot hear each other yet. I don't think Cynthia talked yet.
Maybe they could just leave and rejoin.
I don't know.
But we can hear them, right? It's okay if they can't hear each other.
Oh, okay, yeah. We can hear
Yes.
both them. Great.
Okay.
Then, yeah.
I'm pulling
Oh, they
them.
just,
Do they need to talk to each other?
I think if they can
She
cue
can hear
it.
the room now, but we just opened the microphones also.
Okay.
You know what I'm saying?
Then tell Cynthia worst case, just
And I'm
cue it
worried
up.
about pulling
And then
that
I'll
back
No,
down.
I know. Yeah. If they can, as long as like,
Okay, we
we can
got
hear
a
both
flow.
of them.
Yeah.
As long as they don't need to talk
Yeah.
to each other
Yeah.
in real time.
Yes.
I'm sorry, I know it's
No.
Mics are on its
It's
stage
pretty.
level right now, ladies.
It's weird. This is looking
Glenn behind the audio, if you can hear me.
I'm a little wary of like trying to
Oh,
totally fix
you
something.
can't hear Roy, but Roy can hear you.
Okay?
I can hear it.
Okay? Yeah, I've got these two mics are set to the level right now. It's coming through the house.
Okay,
My
then I'll
voice
flip
is
it call
coming
Roy.
through
Okay,
the
thanks,
house.
Cynthia. Okay.
Is that what we want to do? Oh, because of course the handheld mics will have that.
Yeah. Like I said, so I've got that Zoom going through both. And that's where we had the feedback before, though.
Yeah, that's what we're worried about.
You know, so I want to pull that back down.
Yeah.
And now so
Can you ask both of them to unmute and
I'm not sending them anything except the microphones.
who's the chair for this session? Is it there? For, no, for tutorials, there's the chair.
Yeah.
Oh, really?
Yeah.
So whenever you want to kick it off.
Yes.
Can we see them on screen or?
If you want, we can put up. Yeah,
Can we put them up?
Put the slide.
Yeah.
Hi, Sarah.
Can we share what's on here on the?
We definitely have positive signal from both of these two ladies coming into us.
Okay, good.
We'll go through the house.
Okay, great.
Okay. Can we hear them in the room?
Once I unmute.
Oh, once you. Okay.
Yes, once-
Okay.
We're
Sorry.
hearing like through the room in the
Yes.
monitor. It's not.
Yes, and I'm going to pull those.
Hey, everyone. Welcome to our session. We're just getting set up right now, but as a heads up, the big picture is that we'll start with our remote presentation led by Roya and Cynthia, and then Sarah and I will wrap up with a live portion of the tutorial. So we're going to just let Cynthia set up, and then we'll start with the virtual presentation. So Cynthia, the floor is yours whenever you're ready. Hi, Roya. Just a note that you're muted right now.
Great, thank you, Roy and Cynthia. And now we'll go into the simulation part where I will play the role of a funder tasked with due diligence at a foundation that works specifically with New American or migrant communities. And David will play the role of a tech vendor. The slide behind us summarizes a fictionalized scenario not based on any one conversation, entity, or product.
Today, I'm here on behalf of my company to discuss an algorithm that can determine the optimal resettlement strategy for refugees entering a host country. We developed the algorithm by training a machine learning model on years of historical data, which show that it yields placements that better set up refugees for success, such as employment. We believe that our algorithm can be easily integrated into existing resettlement agencies at low cost and minimal adoption overhead. By leveraging data, we could provide a solution that is beneficial to refugees, placement officers, and host cities alike.
Music to our ears almost sounds too good to be true, so let's dig a little bit deeper into the tool, David. My first question is, who have you involved and consulted with in designing and piloting this technology?
That's a great question. We conducted interviews with refugees to understand the placement outcomes that are most important to them, as well as what demographic information they would be most willing to provide. We also performed pilots of this tool in 2 countries, US and Germany, and received positive feedback from respective placement officers.
How many people exactly, and from what demographic backgrounds have you interviewed? What was the format of those conversations, and are you still in touch with them?
Right, good questions again. These are many of the guiding interviews that we did were informal ones conducted with placement officers and refugees we had prior connections with. For more structured and formal interviews, we relied on research and existing reports.
And speaking with refugees, how do you ensure you're not exploiting or tokenizing these communities? And are these one-off consultations, or are they incorporated iteratively throughout? We want to make sure we're not just checking boxes, figuratively, though literally we are, of course.
So we believe that the input we receive from refugee communities will only go forward in assisting the communities. Beyond initial consultations, though, we have been able to independently develop the tool and evaluate the algorithm.
And you said you've piloted this tech in only Western countries, correct?
Well, these are the countries with the highest numbers of refugees.
So just noting that Turkey, Colombia, Pakistan, and Uganda actually host some of the highest numbers of refugees. Are there people on your team with expertise not just in the engineering or product side, but also in the humanitarian or migration field?
Oh, I didn't know that. And we've had to do our due diligence and research in developing the tool.
Have you used refugee satisfaction with using the tool and with their employment as a result as a marker of success?
Well, for the most part, only placement officers and governments will engage with the tool, and refugees themselves will be abstracted away. Our algorithm enables officers to more quickly decide and advance refugees' arrival so that we focus on the officer's user experience.
Does your team have direct or lived experience with refugees or migrants?
Our direct team, no, but we've consulted people with lived experience. Our expertise lies in developing state-of-the-art machine learning models optimized for matching under constraints.
Can you repeat that for someone like me without a machine learning background?
Sure. Our expertise is in predicting which cities an individual refugee would succeed in the most, given data on where other refugees or similar ones have succeeded in the past.
To what extent does your algorithm account for the individual characteristics of refugees? And how do you ensure equally good matching outcomes for Ukrainian refugees as Afghan refugees, for example? Resettlement is not just about employment or education, but also about refugees' agency, belonging, and safety.
The algorithm will improve the refugees' future quality of life by personalizing matching decisions based on demographic and socioeconomic background. For example, for an Afghan refugee, our algorithm would look at where other Afghan refugees have succeeded in the past and recommend placement cities accordingly.
What do you mean by the individual's background?
Well, to name a few, these could be nationality, gender of the head of a household, education, and so on and so forth.
What does success look like for you? How will you measure that?
So we measure success by comparing our algorithm against the current strategy that resettlement agencies use to match refugees to cities. And we're able to show that on historical data, our algorithm would have improved the probability of employment by 60%.
Really impressive, but do you see successful integration as only measurable by employment outcomes? What other, perhaps non-quantitative measures of success are you using?
So as we primarily interface with placement officers, we also rely on anecdotal feedback we receive from them. And these could be the usability of the system, the usefulness of the recommendation, and further feedback they receive from individual localities that is relayed back to us. Otherwise, we rely primarily on quantitative metrics as they allow us to objectively measure success.
So by relying on historical data, could this algorithm reinforce existing inequities and stereotypes about refugees? For example, data may point to a Syrian who was a doctor in their home country now becoming a cab driver, or Ukrainians may be more welcome in certain cities over Afghans. But is that successful integration, and is integration even a long-term solution?
To be frank, I don't know. And we don't see that as the purview of our company. We're here for a specific function, and we rely on the likes of you and international and local NGOs as the experts to help us answer that question.
So can you tell me a bit about how placement officers could use a tool now?
Our technology can be used by current placement officers as a tool to aid the process. It would not replace them. They would then use a score at their own discretion and be able to override the suggestion or recommendation posed by the score. Our approach also preserves the ability of policymakers to customize the tool and set their own parameters and priorities, optimality criteria, and constraints for the assignment.
Considering the lack of political will and the stereotyped nature of refugees today, again, Ukrainians versus Afghans, how can your company ensure that a government agency won't misuse the option of setting their own parameters and priorities? Have you set in place proper guardrails against the government misuse and abuse of the technology?
We definitely are mindful of how people could misuse the tool, but again, rely on policymakers to work through those guardrails.
And do these government employees have sufficient digital or technical literacy to be able to interpret that score and accurately ascribe importance and not under or over ascribe that importance?
So our algorithm outputs interpretable scores, which are frequently probabilities of success for the individual refugee. But to assist with the transition, we can provide training and documentation to guide deployment of the model, as well as periodic retraining. However, it will be ultimately the responsible of the local placement office to determine the importance of the score.
And how is that score exactly interpretable?
So we consider probabilities interpretable since likelihoods are familiar to most users, and it's possible to compare the probability across various cities. We contrast this against using a categorical score, like a score from 1 to 10.
But what about refugee communities? Will they be able to give informed consent before their personal data is used by this automated tool?
So refugees will be made aware that the data they provide will be used, such as background information, will be used in determining the placement city.
Made aware by whom?
We imagine a government agency could place a disclaimer on a web page, but beyond that, we envision that the tool would be abstracted away from the refugees. And it would be simply improving the decision-making process in the background.
Unfortunately, I don't know if government agencies are always the best at explaining the use of their tools directly, especially to historically marginalized communities. I think the power and responsibility lies with all of us to ensure effective communication, uptake, and understanding and accountability to communities. And no offense if there are any government agencies in the room. And with that, we will want to recap the scenario and highlight specifically 4 red flags from the conversation. So first, and you can refer to the sheet if you want, the checklist in front of you. Flag 21, we always want to be critical of who a tool purports to help and who it is centering. David spoke to having had preliminary but informal conversations with refugees and only at the outset. And his team does not have any lived or direct experience with refugees or the migration field. So how could they have a real gauge of the needs of refugees to help maximize their success and outcomes, and how can the tool have it as a result? And this tool is designed with the government officers, usability and needs in mind, not with the benefit and needs of the communities in mind, subjected to the tools. And then second, we have flag 3, and so presents the trap of techno-solutionism. When David was asked about other measures of success, he reverted and overly relied on a small standard subset of overly quantitative measures that are largely focused on employment. He said the algorithm takes into account demographic info for refugees, which, if it's based on historical data, can actually overlook and reinforce historical and harmful stereotypes and structural inequities among refugees.
So the last two flags, 12 and 14, are all about the fact that users or communities targeted may feel intimidated using the product if they don't have the necessary technical or digital skills. And secondly, it's possible that the vendor could use inaccessible jargon in describing the technology. So we saw me do this quite a few times. One of them was when I discussed the evaluation metrics. There was jargon such as comparing against a baseline, which is perhaps borrowed from the machine learning community, but also vague in general. And then also when discussing how the tool would be integrated in a local organization, this was left mostly on the shoulders of the local organization. For example, things such as using the score at their own discretion, that involves a lot of decision-making on the practitioner's part. And then also saying something like the city or the agency can customize their own success metrics. This could entail retraining the entire model, which again assumes a lot of technical knowledge that is not necessarily necessary. So now we're going to turn things around, and we know this is a really big room for interaction, but we would really like to hear from you all. So if you have the handout in front of you, those are the red flags. And so we're curious for a few minutes if you all could reflect on ways in which you may have seen these flags in your own work or experiences. And if you feel comfortable, please come up to the microphone and perhaps share instances in which you've seen these flags in your own work.
Hi, I'm Maria from GovLab in Chile. So we are working on procurement of AI since late 2020. And we have a different approach. Basically, what we've done is to put requirements in RFPs and like the regulation for procurement, which in Chile is centralized, so there's a procurement agency under the finance ministry. So we managed to work, but we did some pilots where we incorporated certain requirements. For example, statistical fairness as a part of evaluation of models. And so we put this in the RFP for 2 different projects, and we've been testing it out with vendors. And we've done 2 tests. And the vendors that got the RFPs, that got the tenders, were very consolidated vendors. One was a major university, a research center from a major university, and the other one's a major tech company. And it was like we were talking Chinese to them. I mean, sorry, it's an expression, probably not the best one, but it was, foreign language. They did not understand. It took us a lot of work to get them to do the work. Just to, and it was a requirement in the contract. So this is just harder than you think it is. I don't think any vendor in Chile would be, they would all fail. Like nobody could even, nobody could donate, there could be no investment in technology if these were the rules, because just nobody speaks this language, to be honest. So there's a lot of work to be done. We did this in trying to change the requirements, but even if you change the requirements, once you try to implement those requirements that you put as a guideline, it's really, really hard. So I think that we need to do very proactive work with the companies. We actually helped create an association of companies for ethical algorithms that has currently 11 members. The goal is to get to 15. It's like auto-regulation, but to be honest, this is really hard work. And at least in Chile, if we tried to apply this, just nobody would be able to do anything, basically. Everybody would be excluded, kind of. So it's hard, it's challenging. Yeah, so we're gonna be working for the next years with companies to try to get them to change the way they do things, so they can do simple things like model cards, data sheets, statistical fairness, just very simple things, but it's like moving a mountain, very hard.
And I think it will be an uphill process, I think, as we also goes back to the language gap that we're talking about, where it's like there's one particular language and understanding on one side with procurement officers and philanthropies and people on the policy side, people who are more tech-minded, but I think it is about trying to communicate and educate. And I also understand it's like a behemoth document, this checklist, but hopefully it's a starting point for us to have these conversations going forward. But thank you for sharing the experience from Chile, that's amazing.
You're welcome.
Hi, I'm Danny Shaman with Enroll Technology. Thanks so much for joining us today. I'm, I guess, one of the vendors you guys would be discussing, or theoretically. I don't know that we've ever worked together or anything. But I'd say one of the considerations that we've run into pretty consistently that you brought up was the mismatch of technical expertise of institutions that are seeking to have models built. And then the use case expertise as a vendor on the technical side. We've got asked to build models ranging from, every high-risk use case that's been discussed here, from recidivism to job selection to medical cases. Hospitals will come to us and ask to build a model to predict if their patients are depressed. I don't have expertise in that. At the same time, a lot of those institutions lack the understanding of even basic data science, understanding of what errors are we going to prioritize in the model? If the model's going to be wrong, how would we choose? What's the threshold that we're going to use for classification? Really basic pieces like that. That if you leave in the hands of the vendor, you're very reliant on them understanding the space to make good decisions. So I just want to say that I 100% agree that these are extremely real threats, in production.
Thank you for that contribution. And I think that was something we were thinking about in designing this demonstration too, where a lot of times the technology vendor may be coming from a good place, but is perhaps overwhelmed by the various policy considerations, or don't know where that responsibility lies. And so that is where we see the communication gap lies. And so it's sort of just making sure everyone's on the same page, like you were saying, because a lot of times there's technical expertise that is hard to communicate and establish accessibly.
Yeah, so thank you.
Thank you.
Yeah, so I've been on both sides of the procurement spectrum, or all sides, I guess. And one thing I want to say about the who makes decisions and the policy decisions behind small technical details, that is something that I actually think that as technologists we have a duty, especially as vendors, to be really careful that we are making sure people know that that is a policy decision. I have talked to many, as I'm sure you all have, I've talked to many vendors who are oh, that's not us. Or but they don't explain why. Or they're oh, that's a minor detail, so it's us. But they don't explain why. And that is such a huge problem. and something that like there are folks trying to deal with and trying to educate, but like honestly, this is kind of the second point that I wanted to make is like I think the language around government folks lacking knowledge is like really harmful because they don't necessarily lack important knowledge. It's just being framed as like they don't know these things. They know the policy decisions. They know that kind of thing. They know what they want to see, hopefully. Yeah.
Thank you for sharing your perspective on both sides. And definitely, I think it's a nuance in how we communicate, and that's how important so we can understand where the duty and responsibility lies in both ends. And thank you for the added nuance.
So, hi, I'm Mark. I work in healthcare at Duke Health, and there's kind of two tensions I want to point out where I think they're more complicated than as presented. So the first one's in number 6. It's like the second part of the statement. The team is structured in a way that knowledge or decision-making power is concentrated within a small group of individuals. And I would say, I function in an internal R&D innovation capacity, and there's always a tension of participation and innovation. Innovation is not consensus building, and I have to tell that to people oftentimes, that when you're building new products and services or looking, there's just so many different incentives in these large organizations that it's impossible. It's often impossible to align incentives the larger the group gets. So I would just challenge the idea that it's a bad thing to concentrate power within a small group of individuals. I think it's important the perspective that those individuals have and who they've engaged, but I do think that there are definitely trade-offs with being able to do things and being able to delegate too much decision-making authority within organizations. And there's plenty of projects that completely fail because stakeholders get involved that have additional agendas. And that's just the reality of working within large organizations. The other one is between 12 and 15. It is I almost call it the EHR dogma in our industry, that EHR vendors get to say literally what you write in number 12. If the product replaces a interface that is very different to the user, then it's bad. That is lock-in. And we have these large industry incumbents that literally tell everybody oh, you have a third-party solution, that's different than what your doctors are used to. And it's bad to have your doctors go use something else that they're not familiar with. And I can't even tell you the number of times that any change stalls because that point is made, and it's so destructive to progress.
No, those are really good points. Just quickly for the first part, I think exactly to the point of lock-in, that point about concentrated knowledge, we were perhaps observing more from a maintenance point of view. We saw cases where a technology is deployed in a city government, and it's been there for years, and there's a database in Cobalt that one person in the entire office knows how to update. And so I totally see your point on the innovation side. The flag was perhaps a bit more on the maintenance side, but I see both of those points. Thank you for that.
Hey, I'm Ben Green from the University of Michigan. I really appreciate this work that you've all done. I'm curious sort of where you see the public sector actor actually fitting into this. It feels like there's lots of considerations and requirements that are being placed on the vendor, but it feels like a lot of these decisions and actions are ones that actually the public sector body should be doing around whether they need to go procure any sort of AI or algorithmic system in the first place. Perhaps it's the public sector body that should be doing more of the public outreach and community engagement around what are the problems that we want to see solved. Do we think there's a role for technology in those? I mean, I'm sure the answer is a little bit of a yes and, but like, where do you see some of this actually being better for the public sector actor to be doing upstream of the procurement process? And how does that fit in, or what conversations have you had with governments at different levels around, these broader considerations? Because I think from my work, many of the tools, it's not even that the procurement is bad, it's just like the tool doesn't even need to get used. And so it's actually prior to the procurement that a lot of the problems come in.
I will preface by saying two of our main experts are Cynthia and Roy. We're going to minimize the dialogue, so we'll put emails in the slide because Cynthia being at Ford and Roya, the work she has done. But just taking a very quick answer to that, to clarify, none of this is solely the onus on technical folks. And I think when we wrap up, you'll see, but it's like, as a funder, having those questions, there's also reckoning with like my own lack of technical understanding, the techno-solutionism, like sometimes a philanthropy or anyone may be like, oh, let's go to AI for that tool, but that's also a reckoning with ourselves. Like, why are we critically examining going towards technology for a tool? Is it our own efficiencies? Like my background is in refugee resettlement and migration, like, what about the policies we have and systems in place first off before we go seek out tech as a tool? So I think a lot of these questions require an honest conversation on both ends, and it takes two to tango, like to put it very succinctly. And tech can be used well, I know. I mean, there are examples of piloting of similar tools where it has done a lot of good, and this is not meant to be reductive in any way, this sort of interaction. So point well taken that the onus is never on solely one party. I don't know if you have anything to add.
And I think that goes well with the earlier point of acknowledging that the policy side has a lot of knowledge, and I think a lot of the language we often use is a lack of technical literacy on the policy side, but there is a lot of expertise and knowledge there that can be brought to the table.
Yeah.
Hi, I'm Melissa McCradden. I'm from the Hospital for Sick Children in Toronto, Canada. I really appreciated the kind of red flag approach because I can appreciate that this would be something that, like, as a hospital decision-making body, we do interact with vendors a lot, where we could sort of say, here's a couple of the things that kind of allow us to take a pause and reconsider. I'm wondering if in your approach you looked at any of the current kind of regulations or guidance around how we interact with, for example, pharmaceutical companies. So we do have like successful collaborations with pharmaceutical companies that involve a lot of things like proprietary material, sharing of clinical data with companies, and ongoing negotiations, including things like pharmacovigilance and monitoring of patients. Also with medical device regulation, there's certain kinds of claims that you can and cannot make if you are a representative from those companies who might be looking to collaborate with a hospital regarding a clinical trial or some sort of other implementation. Just wondering if you did any kind of background into looking at some of those norms within those fields that might be applicable toward AI.
I confess, I don't think we did work specifically with pharmaceutical companies in interviewing them in the process, but in terms of medical device, I mean, do you have also?
Perhaps very small 2 cents, but coming from perhaps a network science and kind of graph studying background, I know there's a lot of use of AI for, say, drug discovery going on in the pharmaceutical space right now, and I think there it really brings into the question of these kind of evaluation metrics. A lot of them, and this is a very specific part of your question, but perhaps in those domains there's very niche evaluation metrics, which it's unclear how robust they are to actual deployment settings. Maybe they work well in a controlled environment, but it's unclear how well or how robust it would be to a real world setting. And so I think that's where some of the flags could come into question, but again, a very narrow portion of the question that you asked.
And I think, of course, like communities, depending on where the hospital is, who's using the uptake, like given the history of how particular marginalized communities are come into play and their historical inequities, I think a lot of the community engagement flags could also come into play there, based on our conversations. And I think we're at time, so just quickly, you want to wrap up?
Yes, we're going to transition to wrap up, and we apologize for taking 2 minutes away from the next presentation. But yeah, just to conclude things, we know we've said a lot of things. We want to leave you with a few takeaways that you can hold on to. And one of those is that it's important to know that this conversation, as we pointed out, is that of an informed funder, which is maybe not the current case in a lot of situations. And also it's the outcome of reviewing this integration checklist into existing due diligence processes. Also, something to point out is that from the technology side, this checklist forced the vendor, myself, to confront a lot of the limits of the technology. We saw a lot of kind of, oh, I don't know what to do here, and also what we may not know, but what we should know as the technology vendor.
And it forces the funder to confront our own lack of technical knowledge, gaps in our knowledge, the need for more structured and nuanced conversations such as these, and also the language and communication gap that we saw here and that perhaps you all see in your day-to-day as well. Thank you.
For those who didn't get a handout, we'll leave a pile near the door if you want to grab one on the way out.